What's going on, guys? Dr. Greg here with Movement Driven. Today, we're going to be going over an exercise called the Bullet Hole Hinge. This exercise, I really love to teach people how to hinge at their hips properly. So this is something that a lot of people, a lot of patients of mine tend to have difficulty with, especially those with back pain and pain in the lower extremities. When you're doing your deadlifts and your squats, if you're not moving right through the hips, then you're going to put more stress on other things like the lumbar spine and get some low back pain. So if you know that you're not hinging properly during your workouts, this one is for you. Before we get into the exercise, let's just review what a proper hinge should look like, should feel like. What I see a lot of the time in the clinic is clients of mine over rely on kind of locking out their lumbar spine, their lower back. And so when they go to do some sort of hinge drill, they'll just kind of arch the lower back, lock out those joints, and they rely on that stability from the joint congruity to kind of give them the stability that they need from their core. And they're not really activating the right muscles. And I also see loss of posture, meaning they're going to bend through the lumbar spine, through the low back, and start to flex that way rather than solely hinging from the hips. The other thing that could happen is that the end range of that hinge, when you run out of mobility, you start to flex the spine in effort to get lower, but that's not really loading your glutes and your hamstrings the right way, and you're just putting more stress through the lumbar spine. So what we need to do is find our neutral pelvis, our neutral lower back positioning, and maintain that through the entire range of a hinge type movement, whether that's a deadlift or a squat or a lunge or any variation of those, okay? So for this drill, all you need is a light plate weight. I got a 10-pounder here. If you don't have that at home, you can use something sturdy, piece of plywood that you got from an old project out in the garage, something that won't hurt you, but something that you can just use as a tactile input on your butt, okay? So the reason why we call it a bullet hole hinge is we're gonna be shooting bullets right through that hole, straight out behind us. And not to be crude or inappropriate, but I like the visualization of this cue is I wanna shoot bullets out of my butt, okay? So bullet hole hinge, I wanna put that right up against my butt. And as I hinge back, I should feel like my butt is able to shoot bullets out of my you-know-where to the wall behind me, okay? Again, I apologize for the inappropriate crudeness there, but it's a really good visualization for most people because what happens is people come here and they start to lose the posture and they start to flex, and now that weight is going straight down. So use a mirror, look at where that weight goes. It should be going straight back and it should be very parallel to the wall, okay? So what we want to do first is kind of tilt back and forth our pelvis, and I shouldn't be locked out into this arch position. I shouldn't be tucked under. I should have a nice small arch in my low back. And what I want to do when I start this drill, feet are shoulder width apart, by the way. So feet are shoulder width apart, slight bend in the knees. And what I want to do is drive, I'll move my arms so you can see. I want to drive that weight straight back, okay? So I'm not just bending forward and trying to touch my toes and that weight staying pretty still. I am trying to push my butt into that weight to drive it to the wall behind me. And what I should be looking for is a hamstring stretch, okay? So if I get to this point, I should be lengthening my hamstring. My hamstring's coming down, attaching to the top of my tibia and my fibula, which is that shin bone basically below your knee. And it comes all the way up to this pelvic bone right on the bottom of your pelvis, okay? So when we hinge, if my pelvis is rotating the right way, I'm lengthening that muscle. If my pelvis doesn't rotate and just kind of sits still, then I'm keeping that muscle short. I'm not really activating that muscle. So at the bottom of your deadlift, at the bottom of your hinge, you should feel hamstring tension. And if you don't, then you probably need to arch your back just a little bit more than you are. But remember, don't lock it out. So just to review again, we're pushing it back. We're searching for hamstring stretch. And that's where I want to lock it in. And then I'm coming back up nice and easy. And so you should take that feeling into your weighted deadlifts. You should feel load in your glutes and your hamstring. You should not feel it in your low back. Are there muscles working? Should you feel a little fatigue? For sure. But that should not be your primary place where you're feeling your deadlift, especially not your squat. So push that weight back, find that hamstring stretch. We can hold to kind of teach the nervous system where that position is, drive back. And at the top, you can certainly tuck under, clench the glutes a little bit, especially when you start to load with more weight. You should kind of feel that glute clench at the top of the motion, but not for the duration or the entire range of that exercise. All right, guys, so there you have your bullet hole hinge. Really good for learning and mastering a hinge movement, which is a very common issue with most of the patients that come in here with low back pain. So if you're having low back pain, specifically when you're deadlifting and squatting, you're probably losing posture in that pelvis and that low back, and this is a great one for you to try. If you have any questions, let us know.